17th of June 2022 will be etched in the history of the World Trade Organization as a momentous one, as the 164-nation body finally sealed a package of trade agreements after a hiatus of 9 long years. Now, these deals, approved at the 12th Ministerial Conference of the WTO, were ground out over days of round-the-clock talks and include pledges on health, reform and food security, and were agreed upon after intense negotiations over 5 days. So how significant are these deals? What has been India's role in their approval and also the negotiation process? This and much more on the program today. Hello and welcome. I'm Tina Jha, and it's my absolute pleasure to welcome 3 distinguished panelists on the program today. With me in the studio is Mr. Jayant Dasgupta, former ambassador WTO. Thank you for your time, Dr. Dasgupta, and welcome to Sansad TV. And joining us virtually is Professor N.K. Ganguly, former Director General, Indian Council of Medical Research. Welcome to Sansad TV, Professor Ganguly, and Ms. Deepshikha Sikirwar, Senior Editor, The Economic Times. Ms. Sikirwar, thank you for your time. Welcome to Sansad TV. Mr. Dasgupta, let me begin the program today with you. So before we begin talking about how significant these deals are and what exactly these deals are, let me begin by asking you about what the WTO's DG talked about, the new sense, the newfound cooperation among countries at a time when we are facing massive food insecurity and the war between Russia and Ukraine is ongoing. And of course, there have been lots of insecurities in terms of food insecurity, in terms of energy insecurity, and the fact that after 9 long years, there has been a package of deals which the WTO DG describes as a win-win situation. So do you see this as one of the most successful ministerials of the WTO in recent history?
Well, you have to view things in perspective. And one of the things is that after the 2013 Bali Ministerial, in which the trade facilitation agreement and the public stockholding issue were harvested, after that there has hardly been any progress in the subsequent 2 ministerials in 2015 and 17. So this one was held after a hiatus of 5 years, 4.5 years really speaking. And it was very heartening to see all the members of the WTO come together to put together some agreements. Of course, they are not very far-reaching agreements or part of the Doha round agenda, but they have kept an eye on the recent developments in the world, as you mentioned, food security, then vaccine security and inequities which have cropped up after the COVID-19 pandemic, and a few other issues which have also been addressed. But of course, none of them have been addressed in full because there was still a lot of divergence of views which prevailed. So under the circumstances, I would consider it to be a very, very significant development that the faith of 164 members in multilateralism has been emphasized, that people have forgotten their hardline positions and they have been willing to make compromises. And there have been some good decisions, some which may not have gone the way of particular countries or each country, because there are expectations which are always raised about getting 100% of what one expects. Absolutely. But it seldom happens.
And Ms. Sikirwar, the fact that Mr. Dasgupta points out, when the conference began, there was little hope because of the kind of differences that prevailed over the issues that were to be discussed. But 164 nations finally coming together, does it reinvigorate the importance of the WTO once again at this situation, the fragile situation that the world is currently undergoing? And what, according to you, are some of the most positive, tangible outcomes that you see having far-reaching impacts on particularly the less developing countries, of which India has been an important part this time?
Definitely, Tina. I think the biggest takeaway here is the fact that, WTO, there's been progress. There's been a tangible deal on the table. People have sort of set aside their differences. They have, tried to reach consensus on some very tricky issues here. So, and we had seen that, there were questions about, continuous role of WTO, rule-based trading system, multilateralism. Various issues have been raised over the past few years. So this definitely gives a huge boost to the multilateral trading system, rules-based trading system. In terms of takeaways, I think just as Mr. Dasgupta said, definitely this is a significant package, and some compromises have been made to reach a deal. And I think a deal is a very reasonable from India's point of view, because some of the issues which India had been pushing, say the IPR waiver for COVID vaccines, so there's something has been achieved there. There's likely to be progress in the other areas on the IPR waiver. There's been some agreement on therapeutics and other issues. On fisheries, there's been movement forward. So there are a lot of tangibles which are coming out of this deal, and which definitely show that, which definitely give a big boost to this, the whole global trading system.
Certainly, but has it achieved the kind of far-reaching, impact that one would expect, as Mr. Dasgupta was pointing out, is something that I'll come back to you, both of you. Going across to Professor Ganguly, because, it was very important from India's perspective, India-led initiative as far as TRIPS waiver is concerned. Professor Ganguly, what kind of agreement has been reached upon, and how significant is it for these countries who were earlier not being able to, have access to affordable vaccines against COVID-19?
Yeah. So, I will concentrate on vaccines and drugs. Actually, I attended a meeting with Mr. Naresh Dayal and BP Sharma, who was later Health Secretary, on the same issues in 2001 and onwards for 2 years with the nations, so that the nations get few advantages. These advantages were open licensing, IPR pooling, patent pooling, and making the drugs affordable by those who have those patents to the countries. And India has always taken a lead on this, like providing HIV drugs and others to the Africa and other nations. So mostly African nations, South Africa and Brazil, moved this. As far as vaccine is concerned, India's situation is different. India here is actually trying to help other countries, but it will also economically help India. India makes all the vaccines. Only messenger RNA vaccine was not being made, but on the Wednesday, the Genova's messenger RNA vaccine will get licensed. And this is much better than others. It can be stored at 2 to 8 degrees and provides very good. It doesn't die away at 6 months like other messenger vaccines. And its safety is also a little better. So others are being made through open licensing, like AstraZeneca's vaccine, Serum Institute, Novavax vaccine in Serum Institute, the antigen vaccine in Biological E. We also had Sputnik. We had almost all the vaccines being manufactured in India. So what we can do is that we can help African nations now to make these products available to them, because the Covaxin program was to make it available to them, but it was almost a drop in the ocean. It didn't cover the countries. It had a lot of problems because you had to flow the deep freezers and you have to fill in gas in them and then you redistribute it. But our vaccines are quite stable vaccines, and we will be able to fulfill the needs of the African countries very well. Only things which we will not be able to provide are those which we are doing with open licensing. But many of these vaccines have been made by our own technology. So we are in a very good space there. As far as drugs are concerned, majority of new drugs we were having with open licensing. They came from Gilead, Merck, as well as from the Pfizer. But at this moment, hospitalizations and deaths have reduced so much that there is a glut of those drugs. These drugs are now actually rotting, and nobody is buying these drugs. So for this actually there should be no issue. Okay. One more thing has happened as a beginning, that there is an India-US agreement. Under this agreement, a pandemic preparedness US has provided money as well as technology to India, which India can also share with others. So there is no restriction on that. The other ones, there are more better experts available, as it was shown about India doesn't do deep sea fisheries at a distant places. India has electronic needs. That particular thing is still an issue.
Professor
India
Ganguly,
had a
that is
issue in
something
the
that I'll
food.
come to you in just a moment. But because we're talking about the vaccines first, and we are still amidst the pandemic, let me understand from you, which are the countries which are now set to gain the most from this kind of agreement that's been achieved by 164 member countries?
So the most South Africa is more or less self-sufficient. So the countries on the Western and Eastern Africa will be benefiting out of this, and many of the South American countries, as well as some of the neighbors in India, like Bangladesh, like Indonesia. Indonesia is a vaccine producing country but doesn't produce these so well. Even Thailand will benefit out of this. So many of our neighbors like Sri Lanka, Bangladesh, Nepal, as well as African countries and the South American countries, except Brazil. And Brazil is a self-sufficient country in South Africa, in South America. Rest of all the countries will benefit.
Okay, so a lot of countries set to gain from this India-led proposal on the TRIPS waiver, Mr. Dasgupta. But of course, what we learn from the reports is it's not. There have been certain compromises. So will this reduced scope of the proposal that was originally floated will have implications?
There were two aspects to the original proposal of India and South Africa. One was a temporary waiver for 3 years or 5 years or till the pandemic lasted. Now that has not been agreed upon. What has been agreed upon as far as vaccines are concerned is some tweaking of the compulsory license provisions. That a country earlier used to have this provision that it could produce medicines under or vaccines under compulsory license, provided a bulk of it was used domestically. That provision has been waived. The second point is that remuneration, adequate remuneration should not be insisted upon by the patent holder. So these are two of the major provisions which have been relaxed in terms of vaccines. As far as Dr. Ganguly's statement is concerned, India does not really benefit from this kind of waiver, because India, as he's made it very clear, was fighting on behalf of the other developing countries which did not have adequate capacity or no capacity at all. As far as therapeutics and diagnostics are concerned, there is a provision which is opening the door a little bit. That is that whether the extension, that is the extension which has been provided under Article 31 basically about compulsory licensing, that would be extended to therapeutics and diagnostics. The WTO members will have to get together and negotiate it within the next 6 months. But since we all know that deadlines in the WTO are seldom adhered to, so that is an open question whether it will be extended to therapeutics and diagnostics.
Absolutely, and by when that can happen. Ms. Sikkarwar, another important aspect on which India is calling it a spectacular success is the fact that we've been able to defend our stance on fisheries and food subsidy. How do you see India's role in the negotiation process, of course, and at the same time maintaining its stance? There was stiff opposition we all read about from news reports. So tell us more about how India managed to actually defend its stance, at the same time negotiate with all of these opposing parties as well.
If you look at the deal which has been reached, there have been compromises in the deal. So all sides have made certain compromises. So if you look at the deal on fishing as well, a number of concerns that were raised by India, some of them have been taken on board. And one was that developed countries that actually give large doles for fishing, which was also, harming the environment, that has been sort of met. So there is an agreement to reduce subsidies which lead to overfishing. So now this deal is important because these talks had been going on for many years in the WTO's history, and now the agreement is that any operator, there have been some flexibilities which have been given to countries about investigations which member countries themselves would be able to carry out in illegal fishing and so on and so forth. But there is likely to be more talks on this to achieve, to come out with a more comprehensive agreement to sort of, crack down on the fishing subsidy. And that is likely to happen only in 2023. So there is definitely a lot of progress. There is a significant step which has been taken forward, something that India has been criticizing. And India has also been able to protect its own interests because India does not carry out large-scale industrial fishing. The subsidy that it gives is like minuscule compared to what is given by developed nations. So in some ways, some things have been achieved in the deal.
Mr. Dasgupta, what was the opposition from countries? Because what India was opposed to was this draft agreement, which had certain provisions which India was not agreeing to. But the kind of negotiations that have taken place, what is the kind of compromise that you see having taken place to actually bring all 164 countries together or at par, looking at the kind of differences that persisted?
There were three issues basically about the fisheries subsidies agreement, about illegal, unreported, unregulated fishing. India was with the other members on this, that no subsidies should be given for IUU fishing. The second point was no subsidies should be given for overfishing of depleted stocks. So that also India was very much in agreement right from the beginning. The point at issue where India differed was about building up its fishing infrastructure for the exclusive economic zone. Now, India provides, as Ms. Sikarwar mentioned, provides subsidies, small subsidies, it is about $15 per fisherman, to the artisanal and livelihood fishermen who seldom venture beyond the 12 nautical mile territorial waters. The Western countries and Japan, Korea, China, Taiwan, they have already built up their fishing fleets by subsidization. They have built up their processing stations, their cold chain, their landing stations. Now, if you put a ban on any country subsidizing its fishing infrastructure, then it would not hit the countries which have already subsidized, but it would hit countries like India and Indonesia, which were at the forefront of this fight, because we want to build up our fishing infrastructure for marine fishing. And we had announced, and that has come into operation now, the Pradhan Mantri Matsya Sampada Yojana with an outlay of 20,000 crores. So it would have come to naught if this prohibition had kicked in. So that is why we had asked for 25 years. What has happened is, because of stiff resistance put up by India, Indonesia and others, a few other countries, mainly India, that has been deferred. So there would be negotiations, as Ms. Sikarwar mentioned, to get a comprehensive fisheries subsidies agreement. So we will have to enter into negotiations, but as you know, all WTO decisions are taken by consensus. So if India doesn't agree, if Indonesia doesn't agree, there would be no agreement. So to that extent, India has managed to hold its own, has managed to secure its interests for the time being, but we will have to face further negotiations on this.
Absolutely, and secure not just its own interests, but as you pointed out, interests of the other countries which might have been affected if this had sailed through. Professor Ganguly, a lot of advocacy groups now are concerned that what has been agreed upon, and because there's a reduced scope on the TRIPS waiver, it will do more harm than good. And going forth, to make it more comprehensive in nature, a lot of other negotiations will have to sail through, especially keeping in mind those countries which have been hit hard most by the pandemic because of, non-access to the vaccines. How do you see the negotiations building up for the next WTO ministerial?
So actually, the vaccine scenario is totally different than drugs. Like drugs, India can manufacture if you don't give, if you don't invoke patent. India follows patent laws. If you don't invoke patent, India can manufacture it within 3-4 months of the drug being out. And that is why they were giving, all the companies were giving open licensing to India, which could not export these but could use within India. Vaccine is a little complex. Here, it is not only that you give the technology, you have to, that you waive the IPR, the technology transfer has to happen, because it is not that you synthesize it in a jiffy. There are a lot of things which are needed for that, and also the capacity to manufacture. But some vaccine like messenger RNA could be synthesized in the drug making companies also. So there are some sunlight shining, and others will be on paper until we wholesale technology and capacity development also happens with that. Other part over here is the raw materials. Raw materials, even now India gets from the either EU nations or USA, and they had all clamped on the raw materials. So India's capacity to manufacture in large amounts was hampered. And when they lifted the defense laws and some of the restrictions, only then it happened. So I wish that this part was not discussed in the WTO. I wish that raw material availability to the developing nations should also be made available. Then one of the very major part will be that if we do the IPR waiver, even if we build up capacity, even we help them build up the facilities, the supply chain, till then somebody need to supply them with the enough vaccine. And so supply chain management will be very, very important. And the countries who are now controlling the supply chain on the world should also facilitate that. The world over supply chain is really at a big problem. And because of the rising of the oil cost and other costs, they have become very, very costly. So these nations which are low income countries or middle income countries, there the affordability also becomes very, very important. So just lifting IPR is not going to do everything what is needed. We need to do much more over there. And here all the countries, India, I will say India is a developed country now, although there are disparities in the population. And all the developed countries, India, China, and countries in the West need to come together to join hands together to fill in the gaps. Every country has some gaps, and these gaps can be filled up by another country. So we need to come together to solve this problem of misery around the world, because there are so many disadvantages. You can't travel if you do not have 3 vaccine doses. Not all vaccines are certified by EU or United States or the other countries. Only WHO listed vaccines are certified. So there are problems in the trade, problems in really starving. The B4, BA4 and BA5 is now coming up, and they are creating problems. So vaccine availability is one of the major issues. So while we do the IPR, we should make vaccine available to poorer nations at an affordable cost.
Absolutely. Mr. Dasgupta, what Professor Ganguly implies is whatever these deals, the package of deals that we are talking about and which are being hailed as landmark today, only take care of the short-term benefits for people across the world. But to have far-reaching impacts and to have tangible outcomes that have been envisioned, a lot of other coordination and a lot of other scopes have to be broadened. So in that aspect, where do you see see these deals going forward to have the kind of tangible outcome, the better positive results that we have spoken about?
Well, this is a long haul, and WTO agreements very seldom can take place within a short span of time. This is opening of the door. As Dr. Ganguly mentioned, for medicines, if the TRIPS waiver had been given for COVID medicines, it would have been very beneficial, because India and many other countries have the capacity that they can produce these medicines in a short span of time if patent waiver had been given.
Absolutely.
Similarly with diagnostics, diagnostic tools, medical devices and the lot. So that would have also been very useful for providing these facilities or these benefits to the poorer countries at an affordable rate. Now that has not been done, but the door has been opened to have negotiations within the next 6 months. As far as vaccines are concerned, the complication is because of the complexity of the process. You first have to have the ecosystem, then the supply chain. Most of the components of these vaccines are still being imported. And there are restrictions. Of course, there is a decision in this ministerial that countries will not, put export restrictions on these components as far as possible. So it is a best endeavor clause. Any country can violate that. That it's not binding. That is the way the WTO works.
Will always take
that is the way WTO works. So it is opening of the door, but there will have to be a lot of follow-up action. And the final thing is, it is not something which can be just, resolved by looking at your wallet or balance sheet, especially of the large pharma companies or the large developed countries which have the technology and the resources. There has to be a decision taken from the heart for providing succor, for providing relief to humanity as a whole. Because as everybody keeps saying, you are not safe unless everybody is safe in this world, as far as the COVID.
Absolutely. And in that context, even though, Ms. Sikirwar, very quickly, even though the WTO has sent out a strong message by, approving these package of deals, but what's important is that in the face of the pandemic, in the face of the geopolitical crisis that we are witnessing, these are just some short-term benefits that we are talking about. The World Trade Organization needs massive overhaul, the reforms, the long impending reforms. So although a little has been spoken about the kind of reforms that the organization needs to, but to actually talk about the kind of reforms, the kind of changes that we would like this 27-year-old trade body to go through, what is your take on the kind of overhaul that this trade body requires?
Tina, first of all, I'd like to say, this deal, while, a lot has not been achieved, but a lot has been achieved also. There is a deal on the table, and which is significant considering, this deal has come about in 7 years. For 7 years, there had been no deal. So on a number of issues, there has been forward movement, and which is, I think, the biggest takeaway, that it sort of brings back the whole multilateral trade body in focus, the fact that things can be done. And one of the key issues which I think all members would like it to be addressed going forward is the reform of the body itself, the rule book itself on what should be done, how should be done. And, we had seen, there are crucial bodies like dispute settlement. There was literally paralysis because, appointments were being blocked by one country. So the whole role of WTO had come into question, because the key role is, if there is a dispute, how do you resolve it? Because the body which has to resolve the dispute doesn't have people there.
Yes.
So why should such a situation be allowed to take place? Why how did it come to that? So I think all these would need a relook. And the fact is that there is a commitment to having these discussions. There are also, from India's standpoint, we've been saying on the special and differential treatment that these reforms should sort of come about.
Absolutely.
So
India has
there
very
is
strongly
definitely
spoken about the kind of
recognition.
reforms.
Yeah.
Sorry to cut you short, Mr. Karwar, absolutely running out of time. But the fact is there have been some important deals, significant deals, which will have positive implications on people around the world. And this is something that India sees as a massive victory. So these deals that have come about after a gap of nearly a decade, and this is something that we want the world to actually take note of. In a way, there are reforms that are required for this trade body, but of course also the fact that some deals have come through is something which is most vital. So with that, I'll have to wind up the discussion. Thank you, Mr. Karwar, Professor Ganguly and Mr. Dasgupta for joining me on the program, sharing your thoughts, your views with us and our viewers. So that's it from us, viewers, on this edition of Perspective. See you again same time tomorrow now with a new topic and a different set of panelists as well. Until then, take care of yourselves and keep watching Sunset TV.